Okay.
Okay, so now it started recording.
Okay.
So first off, tell us a little bit about yourself.
I'm a medical director at Canyon Ranch Health Institute Wellness Facility. I have been there for the past 6 years. My background is I finished medical school way before you guys were born, and in 1979, if you really want to know. And I then went to a program of family medicine. I studied family medicine for residency and did that, and then went off and was a country doctor for like about 5 or 6 years, and went back to teach for a while. And then I went back into a practice in a big city of Cincinnati, Ohio, and practiced there for like 17 years. In the process of practicing there, I studied a lot of alternative therapies. I went to a program at UCLA and studied acupuncture at UCLA, and then came out here and studied under the Department of Integrative Medicine with Andrew Weil for 3 years. That's where I learned integrative medicine. And then I studied guided imagery for a while and studied that, got a program of guided imagery. And then with all that background, I ended up being a medical director of integrative medicine for a 3-hospital system in Cincinnati, Ohio, and started that program. Was their medical director for like 4 years, and in the process of being medical director there, I was approached by Canyon Ranch to talk about doing something there, and lo and behold, I became medical director at Canyon Ranch. And so I've been there for the past 6 years, and I'm on the clinical staff of Cleveland Clinic. I am also on the staff with the University of Arizona in the Department of Medicine.
Perfect. Sounds good. Nice background. So can you tell us, what does public health mean to you?
Public health, I look at it kind of the macrocosm of what I do a lot on a daily basis. I see patients, and where I take care of my patients, but I see public health as being the community doctor, a doctor of the community, not just 1 or 2 people, but everyone. And they're kind of your watchdog for the community, making sure you're going to get your best shots. Make sure you're going to prevent yourself from a lot of disease states that can result from poor hygiene, so they're kind of a watchdog for the community and taking care of the community. That's what I see public health as.
Very cool. Mm-hmm. Why did you decide to go into public health?
Well, I don't know if I'm specifically a public health physician. I dabble in public health. I deal with community-wide medical problems. Like I was on the Surgeon General's task force for cancer prevention and cancer reoccurrence. And so there you kind of have a work in terms of there are other physicians and nutritionists and people in the business world that are affiliated with cancer in terms of how can we prevent cancer from occurring in the community. And you come up with a group decision on what ways that you can do that, what kind of risk factors are out there to hopefully decrease the incidence of cancer and cancer recurrence. So I see that as my role in public health. I think it's one major role. I see also working at Canyon Ranch, it's not officially public health, but I do have public health issues. I see a lot of people that are leaders in their community or leaders in corporations, and because I promote wellness and health to those individuals that are CEOs or directors of programs, I feel that I can give that to these groups of people that then can disseminate it amongst the peers or the people they work with. So that's kind of a way of public health.
Okay. Next question. Could you share an issue or accomplishment in public health you have addressed that you are especially proud of?
Oh, I think, I don't know if there's one thing or 2 things or any major things. I see one of the proudest moments is working with the communities back when I was a small town country doctor of 2,000 people in the community. And there you kind of work with the whole county, and you work with the community that way. In the town, you become the team physician. In the town, you become the head of their life squad system. In the town, you become the charge of all the teaching for all types of first aid. So, and then you go to the hospital, and because it's still a small hospital of only 50 beds, you become in charge of their intensive care unit. You become in charge of so you work at a kind of a community base like that. So, and that was a lot of fun. It was exhausting, but a lot of fun. So I see that kind of as my community, giving back to the community.
Were there any challenges you faced, and how did you overcome them when you were in this mall?
Every day I walk out of my car and go to work, there's challenges. I don't, you know what, I think this is something I've learned in terms of when I lecture on peak performance. You guys lecture on a lot of alternative therapies. And I think one of the biggest things that helps me overcome issues in which seems like things are going bad with a patient, or things are going bad with what's happening in life. I try to focus on the present moment. So it's so simple to talk about. It's not so easy to do. But anytime that things are going bad, or I'm working with a patient and things just don't seem right, instead of getting all frustrated about that or what's happening during the day, I have to see 5 patients and I've only got time to see 2 or whatever scenario, I do a little breathing technique, take some breaths. They're very simple breath techniques. There's many different out there, but the one I use is the same thing that the Chinese divers use every time they go off and win another gold medal, is they take 6 seconds to take a breath in, they hold it for 1 or 2 seconds, and they blow it out for 6 seconds. And what's so interesting is that it really brings you back to present time, you focus, and you take care of what needs to be done. So I think I use that all the time.
What advice would you give to someone just entering into the field of public health?
I think if you're interested in doing public health, you've got to be, first of all, I don't want you going into it because you think you're going to make $1 zillion, number one. Number two, I don't think you should be going into public health if you don't have an incredible heart. I think that's really important. I think you have to be somebody that really is into giving, and not giving to the point to exhaust yourself, but giving yourself back to the community, giving yourself to patients and people. And you've got to have that heart first, because if you don't have the heart, you shouldn't be going into it. So if you become work on an assembly line or whatever, but you got to, because people, it's very interesting. You look in the healthcare world, and you can always talk as a patient yourself or as the community. People know right away whether or not you really care about what's going on, and it's really important. And it's so interesting. One of the first things I always tell somebody when they tell me this horrendous story about somebody dying, they've had this terrible illness. One of the first things I always say is, "I'm really sorry," and I don't say it glibly. I say it because I really feel sorry for these people, and they hear that, and and then they feel, okay, I'm in the right room, I'm in the right present, can open up with you more, or just thank you very much for acknowledging that. I mean, so many times people, patients, they'll come in, they'll say some horrendous, terrible, awful things going on in their life, and the doctor will just tell you in the computer, and just put that, and what day was that, and it's like, no, the answer is, you've got to listen to them, and having them. So in public health, you've got to have that heart. You've got to hear what they're trying to say. That's really the most important thing.
Okay, and one last question for you. As a doctor, what has been your most craziest experience that in all of your time that you've been in medicine, what's the craziest story that you have to tell?
I have a lot of crazy stories, but probably I think the one that always comes to mind was I was just fresh out of medical school at my residency program. I went to the little town out in the middle of nowhere, and I was on call for the hospital, my big 50-bed hospital in the middle of the wintertime. And it was snowing, and it was a miserable night. Now and then also, back in the Midwest, when it gets between warm and cold at night, a lot of times you get a lot of major fogs come in. And I got a call from the hospital. You got to get over here. This lady's pregnant. I mean, yeah, she's beyond pregnant. She's delivering a baby. So I fly over there, and she's a very young gal, and she's delivering a 27-week-old baby. Okay, and we're out in the middle of nowhere. And there's sometimes you try to, just try to stop labor. The head was coming out. It's not like, okay. And the closest major hospital is like an hour away. So I'm trying to stay in the moment and ask the nurse, you call the hospital in the big city, tell them to send a helicopter. I'm going to try to deliver this baby and we'll have to intubate this baby and pray that this helicopter comes. So I delivered the little 27-week-old baby. This baby at that age has very poor breathing capabilities. Had to put the tube down into the lungs, and you wrap them up in this aluminum foil kind of just to keep them warm because they can't control the body temperature. And the fog is coming in, and it's the middle of the night, and they're talking to the guy at the helicopter pilot lab, this baby in my hand and bagging him, saying, "Please land the helicopter." They went, "Oh, there's no place to land. It's getting foggy." And I said, I called the fire department, and I called the police department and said, "Be at the football field with your lights shining right to the middle of the 50-yard line from all ways, and we will hope that this helicopter will land in the middle of the 50-yard line." And it did, and the fog was coming in, and the guy says, "I can't believe I did this." I said, "Here's the baby, take it to the hospital." And I think that was that was one of my wilder moments.
Awesome. That's a fun story right there. Okay, well that's actually all the questions we have for you. So
well, thank you, ladies.
You so
You've been
much.
a very good audience.
That's really cool. Where was